Hi everyone, welcome to Chiromo Hospital Group's PodMind, your go-to mental health podcast. This episode is brought to you by the Tufunguke Initiative. This is an initiative run by Chiromo Hospital Group that seeks to create a space where we can have open and candid conversations around matters mental health. Well, I am very glad to be here today with what I would call a beautifully curated panel, and I'll give them a chance to say hi to our audience and tell you more about what they do. I will start with my farthest end.
Okay. Hi everyone, my name is Miriam Mugane. I'm the Psychology Services Manager at the Chiromo Hospital Group.
Hello, my name is Faith. Today I am wearing many hats. I will start with I am a clinical psychologist. I am also a professional dancer and also a founder of what we are about to discuss today.
Hello everyone, my name is Meshak. I'm a dance entrepreneur, I'm a dance choreographer, I'm a dance performer, I'm a dance, just name it all. Dance defines me. Yes.
As I said, beautifully curated panel, and this is why. For those who don't know, May is World Mental Health Awareness Month, and this year the theme is movement, moving more for mental health. Now we have a program that has been running at Chiromo Hospital Group that we will talk about a bit more, and we thought it best to make the most out of this program. For this month, as we are commemorating Mental Health Awareness Month, we are going to be talking about dance in the line of movement. And I'd like to start with you, Meshak, as you said. Dance is it all. Why dance in the first place?
Wow. Dance. So I've been dancing for the past 10 years now, professionally. This all started when after I left high school, and I didn't know what to do after that, because especially for men or for boys, when they are out there, they just want to get out of high school and do whatever they want to do to gain the freedom. And once I was out there, I didn't know what I wanted to do. I was just a confused element. And I remember I used to love watching people dancing. I wasn't a dancer per se, but in the process, I decided to try it out, and I found that I was a natural, So it's something that was in me. Despite enjoying watching, I could dance. And from then I decided, okay, this is a route that I'm going to take, because I realized when I was dancing, I used to be very happy, and I knew this was the thing for me, and I couldn't look farther away but to stick with dance. So 10 years down the line, I've been doing that, never looked back, never wished to do any other thing other than dance. Been teaching schools. That's where I started teaching schools. Then I went to the gyms. Then I went to the offices, corporate offices. Then I found myself now in Chiromo teaching dance as part of therapy. So it's been quite an interesting journey, and I'm super glad to be in this panelist.
I'm sure I'm not the only one who's surprised that you started dancing after high school. To people who are watching this, I've seen Meshak dance for quite a while. You'll probably see his videos somewhere, and it's impressive that this started after high school. And in your experience, because you're here with us at Chiromo Hospital Group, as I'd say key choreographer when it comes to dance therapy, why I think you would tell us a bit about are there particular dance styles or dance genres that are fit for mental health in that therapeutic approach?
First of all, I'll start by saying dance is more than what people see on stage. Dance is more than what people see. For me, how I define dance is the freedom. Dance is an expression. Dance is therapy. Dance is just it's joyful. I remember when I started doing the dance as part of therapy program here, I was a bit scared because it's something that not most of the people who are doing it, and I feel like it's not for everyone, because I've tried talking to most of my dancers to try and make sure that we are in the same journey. Try to impact whoever you meet with what you have as a skill, you know. And once I came to Chiromo and I started doing the dances, dance is part of therapy for the mental health. It was not something that I thought I would pursue, you know, but interacting with people and doing the moves and making people move and giving them that safe space for them to be themselves. It was a turning point for me. I was like, okay, so if this is how the people feel, or if this is how they look after dancing, then this is it for me. Because now dance for me is positively impacting whoever I meet through my skill. So I wouldn't say there's anything particular when it comes to dance for mental health. Any dance, so long as it defines you, so long as you're able to feel the freedom, the expression, you feel like you're in your zone, just do it. Just do it. There's nothing in particular.
Wow.
Yes.
Just do it.
Just do it.
Just, you know, let yourself free. And actually, from you saying that, I have a small experiment I want to try.
Yes, please.
I'm throwing each and every panelist under the bus here. I know you're not sure about this.
Okay.
I'd like to challenge all of us just now to jig a bit, to dance a bit, to move a bit from wherever you are. Just to do something small. And I want to, it's just an experiment I'm running right now.
So everyone is doing that
Everyone now, and you know, go. Let's just try and dance.
at the same time.
Yeah,
Do something, eh?
just do something.
Jiggle, jiggle. Yes.
Okay, how did that feel? Maybe start with that. How did that feel?
Well, felt good. Surprising. I didn't expect jigging. But it felt good.
Okay. I'm running this experiment because, as you said, Meshach, once you're there and you start dancing, it just flows within you, that it brings something up. And I wanted to see, actually, for those who are watching us, no one was dancing here with a stiff face. Everyone just had to smile at some point, laugh a bit, and I think it's sitting more into what you're saying. This is an important time to invite you, Faith. You're coming in with very significant hats for this conversation, as both a psychologist and a dance instructor. Perhaps you could tell us a bit about how that has been for you, and why this is important even in mental health.
Thank you very much, Pendo. I'm about to blow your mind because just as Meshach, my relationship with dance started when I was 16 years old, fresh out of high school. I was a very turbulent teenager, if I may say that. A teenager who even struggled with articulation and communication, emotional dysregulation. When there were systems, everything was great. But after high school, no systems, there's a lot of freedom. So imagine the confusion that hit me. I stumbled upon dance when I was studying French. And then I only realized then that my interest was less with French and more with dance. And that's where my story with dance starts from. Dance is not only for adults, it's also a tool that really supports teenagers, and there are studies to show and support this statement. I would say when you're dancing, you don't have time to think and worry. You don't have time to worry about the problems that you have in your day-to-day. When you're repeating movements now and then, doing the same thing for 10, 30 minutes, the repetitive nature of dance itself is calming. It's meditative, It produces happy hormones that really bring out the smiles you were talking about. So when I look at dance and the concept of dance movement therapy, I feel like there's a heavy connection that we need to also jump in on this train as Kenya to really combine the traditional treatments we already provide in mental health with dance movement therapy. There's a lot of value it brings to offer.
Certainly, I think it's about time we include newer ways of giving overall wellness. We've incorporated art therapy, we've incorporate dance therapy. And this is, I'm saying we as part of Chiromo Hospital Group. And at this point, I'd like to invite you, Miriam. There's this program that has been running, I think to the best of my knowledge, for about 4 years now. Why was it important for Chiromo Hospital Group to put together a dance therapy program?
Yeah, when we look at the mental health space, when we look at research, we see there are advances in terms of forms of treatment. And research has proven that there is a mind-body connection. So even if you look at all the disorders that we are treating, let's talk about depression, for instance, you will have a physical symptom. Okay, someone can't get up, does not have the energy, you know. If you look at trauma, there is a physical symptom. You look at anxiety, there is a physical symptom. And so you find some of the interventions, there's what we call the top-down approaches, which are interventions that deal with the talking, right? So we are changing your thoughts, we are helping you to change your thoughts. But then with research, they have found that there's the need for the bottom up, meaning you're working with the body, to help bring transformation. We have seen with children, with teenagers, and even adults that people can encounter things like trauma, right? Very significant, and reaches a point that they don't know how to verbalize. Okay, and they are trying to express themselves. Sometimes the feelings are not well articulated, right? But when we work with them from the body perspective, we first bring in the aspect of regulating the body, regulating their nervous system. Then now we regulate the emotions, okay? And then now we are able then to work with their thoughts, okay? So it's meeting where the client is. And because we are all very different, we are also artistic, we are also very mathematical. I mean, people are very different. With the artist, it would make sense to work with them from the body perspective moving up, because that is the language they understand, as Meshach has mentioned and as Faith has elaborated. We find like teenagers, many of them, they're going through a difficult patch, but they don't know what it is that they're experiencing, but they give them music that is in line with what they are feeling. Like if they are angry, give them hip hop. And they start dancing and the anger is gone. So dance is a vehicle for transformation, whether you're well or whether you're not well. If you look at someone who does not have a mental health disorder, maybe they have stress, you'll notice that they'll say, some people will say, I have a headache, my back has locked, my shoulders are painful. Again, a physical component, okay? Take that person to the dance floor and something happens as they move, okay? So the body is also able to relax, you see? And also in terms of our body, we have a rhythm, a natural rhythm, like the blood flows in a rhythm, the heart flows in a rhythm, right? So when we are anxious, that rhythm is set off, right? But if I listen to music that carries me in a rhythm that is calm, I'm able now to stabilize my body. Okay, and I'm able now to get clarity of mind to be able to handle the problem I have. So it's really powerful. In fact, we should all be dancing every day.
Wow, the connection there from the body all the way to how it impacts our mind, the different forms of music that you can even incorporate in this. And as you said that all of us should dance, it took me to one of the most frequently asked questions when we're around talking to patients to invite them for dance therapy. And I'm addressing this to you, Meshach. And one of the questions is, dance, mimi nitaweza? Will I be able to? Is it for everyone? And you invite them, it's for everyone. But we are handing them over to you, Meshach. This is something that I would say have two left feet. And I'm being invited to go for dance therapy with Meshach. Does it apply for everyone? what response do you have from that patient who is asking?
Thank you for asking that question, because I've come across that so many times since I've been working with Chiromo for over 3 years now. I meet patients who are like, we have 2 left feet, but the question that I pose back to them, can you walk? And they're like, yes, we can walk, but we can't dance. But the secret behind dance is how you shift your weight in time with the music. It's not about how good you are of a dancer, but how can you be able to balance that when you're listening to the music. Just the same way, it's all about muscle memory. And ideally, when you listen to music, as Marianne said, there's something that moves you from the inside. So number of times I meet patients who come down there for dance therapy, but they end up sitting down. But the 1 or 2 people who I have with me there, I'm like, you know what? It's just a safe space. I just want you to do whatever you need to do. Listen to this music, move to it, express yourself however best you can, And once that's triggered, that's it. The people who are seated there, they'll start joining one by one. Why? I give them the safe space, You can come, you can watch, it's okay. If you feel like you want to join in, please, you have that freedom. Because at the end of the day, it's more of expression. Because we have people with mental health challenges. When someone comes there, they will look at you, they're like, how do you expect me to dance and I'm in this condition? But I'm like, you don't need to think about it, just need to try it, just test it. That's all you need. And once that person is in that mood, you will even wonder, is this a guy who was saying they have 2 left feet? And that's what keeps me moving, because I'm able to impact that person to know that it's never about perfection. It's just about progression and how best you can express yourself. Just think on a daily lifestyle, whatever you do. If you're working or if your profession is playing football or singing, when you're in your element, you don't have to think about it. You just allow it to flow. So same with dance. The advantage with dance is that there's music. And when there's music, there's that rhythm. When there's the rhythm, there's something in our body that tells us, you can't just be listening to music and you're like this. Trust me, when you hear your favorite song playing, you are lost in it. You don't even have a chance to think about, what did I eat yesterday? No, you're in that moment. And that's what really matters when it comes to the dance therapy. You just need to be present. You just need to allow yourself to feel the way you need to feel. If you want to scream, please go ahead and do that. No one is going to judge you, because that's the emotion you feel at the moment, and that's how I go about it.
I started off by saying that I believe I have 2 left feet. And I can also confidently say that I have joined some of the sessions in dance therapy. And my prowess was not a factor. And at the same time, I am sure, 100% sure, I left that session feeling a lot more energized. And this is actually bringing us to the aspect of wellness. Faith, you talked about how dance came in for you. It offered structure as well as expression. And for you, what has the impact been where dancing and wellness is concerned in your experience?
I'd say it's added a lot of value, wellness-wise, to a point where I hadn't realized it until I actively got involved in the psychological field. And then I would now make connections that I didn't have before. I can go back to when I was in college, for example. We all understand the life of a college student. If I'm not studying, I'm probably partying or having fun, or, a little bit of a turbulent time also for most people in college. But in college, I joined a club that was teaching. They would teach the dance, and in 3 to 4 days a week, I had something healthy I was doing, something that would release whatever stressor I built up during the day. I had no idea that was what was happening. It helped me not expose myself to a lot of unhealthy ways of dealing with stresses. I had grown up sheltered. in college, being in a dance scene, I built social connections. I would never have said I'm an extroverted person or I enjoy it then. But with dance, the community that it builds and the safety that it brings with it, that is something that I will never take for granted. Something I will always be sure, if I go to any dance social anywhere, the people there are open and warm and they want to spend and experience whatever it is with me. And that's the social nature of dance. What Meshach was talking about, releasing mood, and it has a lot of benefits. And I think also now from the perspective of a psychologist, for all of us who do dance for a therapeutic reason to give to people, I think the thing that sets us apart from regular dance instructors is the understanding and the patience that we would share with people who are experiencing any mental health condition, and the patience, just telling them this is a safe space. Come, move as you are. Try to learn as I teach, and being very patient and not having to do too much at the start. So building that slowly, because even with research and studies, you don't get all of these benefits in a sitting. It's a period. There's one I saw. There was a period of 6 months, and they would do it 3 times a week for 1 hour. So you slowly gain from this process. It would be perfect for any individual with depression. It would be like behavioral activation, It would alleviate anxiety symptoms. These are all things I have personally experienced, and any clients of mine who have been able to use dance as a tool have shared the same insight.
Okay, wow. It's very interesting. And what you said towards the end is what I wanted to extend to Miriam. Professionally, you said how dance can be used in managing depression, anxiety, in terms even of behavior activation. Perhaps you could tell us a little bit about the behavior activation and how it helps with these mood elements.
Yeah. Okay. So ideally, most of the disorders we have or we treat, there will be an aspect of dysfunctionality in terms of your normal life living, from getting up in the morning to doing your duties, whatever it is. So when we're talking about behavior activation, is activities that we put in place in the treatment of whatever disorder that we are addressing to help you now begin to become more functional. And these behavior activation activities are diverse. Okay, I know we are talking about dance now, and you're wondering, why are we focusing on dance? And there's things like exercise and but you find, for instance, when we have depression, where your level of motivation is very low, for instance, you're not motivated to get out of bed, you're not motivated to do anything. And perhaps starting on to go to the gym, that may be very difficult. But put on a song that means something. And you slowly start nodding your head. As Meshach said, there is something that happens when you put on a jam that that you really love. The body responds to it. It's not responding at a mental level. No, it's responding at a physical level, right? So now the music becomes like what we would say wind under your feet. It's carrying you. It begins to motivate you, it begins to give you the good feeling hormones, right? So that now starts boosting you, and now you are able now, and again, remember, you are listening to something that is pleasurable. But the disorder is not pleasurable. It's giving you a lot of negativity. So now you are injecting a lot of positivity with the music, okay? And as you begin to slowly sway, to this music, you begin, maybe you sway for the whole song, then you're like, wow, today I managed to sway to that song. Wow, it's now built even your belief. I managed to do something. Maybe you could not get out of bed before. I managed to do something. Wow. Okay, it starts building your hope. Yeah. So you start feeling, at least maybe I can do something else. Let me put on another song. So this is what I'm talking about, the music or dance being a vehicle. Okay, so it's taking you from where you are and moving you to a place slowly to where you want to go. Okay, so we find that with long-standing conditions, depression, trauma, even physical conditions such as cancer, dementia, we find that there has been great value. Okay. We find even children who grew up in homes that are very, there's a lot of discord and a lot of dysfunction, maybe a lot of fights. Yeah, and this child has to go back to that home. These are their parents, and maybe the parents are fighting all the time, and it's creating a lot of internal difficulty. Yeah, this child just needs to put on some music and move, and that day their mood changes and they're able to face the next day. Okay, and so it's music and dance is both preventative. Yeah, it creates resilience, but it also treatment. Yeah, and if we look at our histories, all of us, we all had music in our traditional setups. Yeah, there was music and dance for the rain. Yeah, there was during circumcision. If we look at other countries where there's been very difficult political situations, such as South Africa during apartheid, the resilience that music was always part of their instrument of resilience to get through. If we look at slavery, they sang and danced. So there's something about dance that it has a resilient factor in sustaining people through difficult circumstances, whether it is in terms of mental health or in terms of our environment. Yeah, and it's something that is free. Yeah, and you can do it in your house, you can do it anywhere, and you can also, pay for it for treatment.
Even as you say that, I just remembered it's one of the skills, if I would say, I don't know if it's a skill really, that you don't even have to be taught. I think it's one of the first things a child does once they're growing up. When people start talking, they can already move to a beat, which is it speaks to all you're saying. Very interesting conversation, and we're coming towards summing it up. And we not only have this conversation, we also lined up something very interesting that I would like to give Faith a chance to tell us more about. All I will say is move your body, move your mind. Faith, tell us more about this.
Thank you. I even forgot about it. I was really enjoying the conversation. Move Your Body, Move Your Mind is an initiative to push the conversation we're having right now. The connection, the top-down approach, the connection of mind and body. In this month of May, because of the initiative movement for moving more for your mental health, it's our first episode, is it an episode? The very first one that we're doing. We're going to be focusing on bachata, specifically the sensual bachata music and dance. Reason why is because sensual bachata brings a lot of body awareness. It adds a lot of connection with emotional release. I want to connect it with the book Body Keeps Scores. If there's any of us who have read that book, the concept of the book is that our body remembers any traumatic experience that we go through, and it stays in our body in form of tension. It can manifest as pain. So you might go through healing and treatment, but you feel like you're not really making progress because your healing is stunted because you're disconnected from your body. But now you bring dance, and especially a sensual dance that allows you to connect with your body through music and movement. You're able to release this tension from your body, initiate relaxation so that your body is able to respond whenever you are triggered by fear or in an anxious space. So that is exactly why we're starting with sensual bachata. There are very many more sensual dances that are welcome to be part of the initiative, but thankfully this month our ladies get to enjoy the privilege. I know Meshach was telling us we are being discriminated, but courtesy of also the Nairobi Dance Project and Chiromo Hospital Group, we're able to bring this out and share with the public. Yeah, and I'm really looking forward to it. Yeah.
Thank you so much, Faith, for introducing that. As you've heard, we have a workshop that is as a collaboration of Chiromo Hospital Group and the Nairobi Dance Project on sensual bachata. I don't know what that is, but I will know in a matter of moments, and I'm really looking forward to that. As you've heard, Meshach asked about the men's bit. So if the men listening to this, if you feel like we need to have a follow-up for the men's edition, please engage us. Based on how you respond, then we can see what we can do about that. But fortunately, the ladies get to enjoy that this month. So we're really looking forward to that. And we will be having a lot more activities and engagements, so feel free to keep up on our social media platforms to know what we are working on. That brings us to the end of this conversation. I would like to extend a chance to all of my panelists to give a parting shot just to sum this up. Let me start with you, Miriam.
Yeah. For me, I would say let's dance. Yeah, let's move our bodies, whether we're in the house, whether we're in a good place or a bad place, let's just dance.
For me, I would say, I know we're talking about dance therapy, but I would like to also highlight that it's not supposed to be used as a replacement for traditional treatment. If you're going through a tough time and if you're going through a turbulent time, kindly seek out to a professional. And I would also like to encourage my fellow professionals to incorporate alternative and complementary treatments now, like dance movement therapy, into the treatment plans for the clients, especially when you're seeing there's a lot of resistance here and there. It does not hurt to mix and match and see what best works for your clients. Thank you.
Wow. They've summed it up all. But as a professional dancer and a performer, I would just say, just be in it. Just be in it. It's lifestyle, it's freedom, it's movement. It's a way of expression. So if you feel like you just want to get lost in the movement, please do that. And again, not to discriminate any other forms of treatment. Just allow yourself, do what makes you happy.
What makes you happy.
Yeah.
Well, there you have it. For everyone who is listening to this, let go, be free, open up, tufunguke. For anyone who's listening to this and who this is the first time you're hearing that term, or maybe you're not familiar with Swahili, that is Swahili for let us open up. And it is there for us to create safe spaces where we can openly talk about mental health experiences. I want to say that wherever you are, if you're going through something and you're struggling, if you're in crisis, I want you to know that you're not alone. We have a crisis line, 0800 220 000, that you can call at any time of the day or night, and that line is manned by a psychologist, so feel free to call that in the event that you really need urgent support. Every conversation that you're having here is going along with the Tufunguke initiative. Let us create these safe spaces for the person next to you. Let us work together to destigmatize mental health. If you would like to see us physically, please feel free to walk into any of our branches. We have 2 in Lavington, that is Bustani and Brayside. We have 2 in Westlands, that is the Chiromo branch, and the Mudidi branch. We have 1 in Nyali, Mombasa, and we also have an outpatient clinic at Upper Hill Medical Center. You can walk in at any time and you will be supported. Otherwise, let us all work together to destigmatize mental health. Tufunguke.